Okay, I'm Tobin Bakari, and I'm going to answer the questions in relationship to the film Resilience. First question: what does resilience mean to you? I think resilience is about the ability to understand, seek support, learn how to apply coping strategies, and establish self care in the aftermath of lifelong adverse traumas. It's something to be cultivated, and it's not really something you're born with. So I think your ability to seek help or to find ways to cope or to address the repercussions of that trauma is the result of how resilience plays into the situation. From your perspective, what stood out? I think what really stood out was a lot of things stood out, but a couple of them was the idea that our society cultivates the perspective that resilience means that the crisis in our lives had no effect on us on a physical level, and that's something I think that is pretty obvious that that happens to all of us. Another one is the relationship of childhood abuse and illness. The research that the doctors did, where they found that 28% is a result of people had physical abuse, 27% substance abuse, 13% um, children have seen their mothers abused, and then 20% with the sexual abuse. So that was pretty profound. Also, another thing stuck out to me was the correlation between the ACEs scores and the smoking. As the ACEs scores went up, the smoking went up. So I thought that was a very interesting connection as well. The next question is, what do you consider the key strategies in the film? I think the key strategies of the film was to stress the importance of the connection of mind and body. The experience in our lives have a direct connection to our physical and mental well-being, and these stressors strongly affect the physical outcomes just as much as the mental ones in our lives. Question 4. What ideas for action does it bring up? Well, the work of Nadine Harris on the or other practitioners and educators and policymakers should look into, like the work that she's done, to look into federal policies to support a universal ACEs screening as an intervention to support children and families. Generational trauma can be addressed with attention to this research, and not to mention the costs, the crime, and the effect it has on society as a whole. Next question. What is one thing you heard or saw that touched you? Well, I thought that the Miss Kendra list was very inspiring. It was such a creative and insightful way to give children the opportunity to express their inner feelings and stress and their stressors, as well as that they get to understand what abuse is and how to recognize it and why it's something that shouldn't happen to them, and that it's not a normal way for a child should live their life. So I thought that was very profound and touching. Um, Next one, what one thing surprised you the most? I think this perspective of this not investigating and disregarding this whole perspective for years. The idea that you know our mental, emotional stressors having an effect on our physical health is something that is very important to the future of humanity, and I just find it very surprising that it's something that was not discussed and was not investigated. What are you going to do now that you know this information? Well, I'm really interested in doing work that strengthens families and parents who are at risk due to ACEs. So I really like to get dig in and get more experience in working with families and working with children in high risk situations. Next one, can you think of 5 people who need to see this film and learn this information? Yes, I can definitely think of 5 or more people who could. So I would definitely try to set up a way for them to see it. What are some examples of situations where you could have asked what happened? Oh, okay. What would you do differently after seeing Resilience? Well, definitely with my own children. I have twin sons, 9-year-olds, and I have one that's sort of an internalizer. So he doesn't always express his anxiety, his feelings about things, and you have to pull it out of him. So when he does something that acts out, the first thing you want to do as a parent is to address the action rather than asking, what were you feeling when you did that, and what made you feel that you had to do that, or what's wrong, So I'm learning that a lot, and I'm learning to kind of ask those questions rather than to focus on what he did, but what happened, to him that would make him react the way he did. See, what are the programs and policies your community, is already supporting to build resilience? There's a few nonprofits around I live in Washington State, and there is one nonprofit that's called Wellsprings, and they do a lot of work, mental health work with ADHD, depression, grief loss, life transitions, relationships, stress, trauma, and that sort of thing for the community and for adults. And they definitely try to do something with work-life balance for parents and family-child relationships. So I think that's a good step in the right direction. What are barriers to implement these strategies in your community? Well, I think that, like I said, I don't think there's a whole lot of focus on ACEs. I don't know how much they know about it, or how, if and when or if it's ever been presented. So that is something to look at. How can you help get around them? You help them get around them. Well, I think one of the things is that it may be that they're not aware of it, or it was something they heard, but they don't really know a lot about it, or they don't really know about the research. So I think a way of if I work in an agency where I can introduce it or have it brought up again and emphasize the importance of it and why it's important and how it can be helpful in serving the community, that would be a good way that I can make a difference of trying to get around the obstacles that there may be of not really being aware of it or implementing it in any way. Thanks.